of them are in the hospital for something totally unrelated to COVID. So you go in for a broken leg, they test everybody who goes in, they find out you have COVID, and they count in the hospitalization number that is used by the media to scare us all. And I ask you, like, I didn't realize that they were getting paid. The hospitals have a financial incentive to do this.
Yeah, so that was from the earliest. The CARES Act, you get $50,000 per COVID patients. For Medicare patients, they would get 20% bonus. The hospitals get 20% bonus for seeing COVID patients. So they have a very strong incentive to diagnose COVID, even if it's incidental.
That's crazy. That's so crazy. Why would we incentivize hospitals to state the number? Or why, at a minimum, wouldn't that be a big asterisk on every media report when we get these naked hospitalization numbers out?
Yeah, I mean, I think in the early days of the pandemic, that's when the CARES Act was passed, the thought was, well, these hospitals are basically, they're going bankrupt because people were so scared to go to the hospital for actual things that they needed. Cancer surgeries were canceled. Many hospitals around the country essentially were empty. Waiting for COVID patients that never arrived in the early days of the epidemic, and I think partly it was aimed at addressing the financial crisis caused by that sort of panic around COVID. I mean, I think that was the initial impetus behind the policy, but I think it has had this unfortunate effect of sort of, I mean, it's kind of a catastrophe, right? Like you have this well-intentioned policy to keep hospitals afloat, but it results essentially in overdiagnosis and induced panic. And I don't think people had thought through all of the downstream consequences when the policy was put in place.
Well, and two other things to note about the study. Okay, so nearly half of those hospitalized with COVID may have been admitted for another reason entirely or have had only a mild presentation of the disease. The increase was even bigger for vaccinated hospital patients, of whom 57%. So keep in mind, so when you hear these hospitalization numbers, so 57% of those who have been vaccinated and are in the hospital with COVID had only mild or were asymptomatic entirely. And then how about the unvaccinated? They've been totally demonized by Biden and others. And this study found that 45% of the cases with the unvaccinated were mild or totally asymptomatic since January 21st. So once again, it's not as awful as they lead us to believe. But how do we square that, Doc, with headlines like this one? COVID hospitalizations hit crisis levels in southern ICUs. This is one of the lead stories right now in the New York Times. Hospitals in the southern U.S. are running dangerously low on space in intensive care units. 1 in 4 hospitals now reports more than 95% of the ICU beds occupied, up from 1 in 5 last month. Alabama, Texas, Florida, talking about problems there. So how do we square those two things?
Well, I mean, I think that actually hospitalization numbers, like in Florida, are with COVID are plummeting right now. So I think the HHS actually tracks this. You can go to a website called HHS Protect and see what fraction of beds are occupied by COVID patients. And the headlines often don't square with what HHS is reporting. I'm not sure why the media aren't using those like official numbers to track it. I think there's another sort of a problem in how people think about this. Hospitals are not single entities that operate simply by themselves. They're part of systems. So when one hospital gets crowded or one hospital gets stressed, patients get moved to other hospitals. They're part of a system, and the question isn't whether a particular hospital is overcrowded or stressed. The question is whether the system as a whole has capacity to address the health needs of a population. I think there have been times during the epidemic where some hospital systems have been pushed to the brink. But I don't think that as a whole, the American healthcare system has been overwhelmed by COVID patients. I think it's been stressed in some places near the brink. And in that sense, American healthcare system has actually operated better than many other healthcare systems around the world, which have been overwhelmed with patients. I mean, this is a real disease. For a subset of patients, it actually does result in the need for ICU beds and